computer.
So don't say anything you don't want someone else to hear.
And I'm going to unmute it. I mean, I'll mute
Mute everyone else. So Chris is going to get everybody muted. Like I said earlier, this is a picture of my dad, who just made 96 this year, being very unstressed, which is a good way to be. And you said I can use this, except it's not working.
I've got to bring the mouse back.
Okay, sorry.
Okay, so now you're on.
Now I can do it. Computers are our friends. Yay!
Okay.
With all the hubbub going on in life right now, I've kind of developed a new mantra. You can't stop the waves, but you can learn how to surf. And so that's what I'm trying to do in all these interesting times, learning how to surf. For those of you that know me, which is almost everyone on the line, I'm an integrative family medicine physician. I am an MD-VIP affiliate, which stands for Value in Prevention. I am trained in my advanced cardiovascular wellness, retired Navy captain, spent a lot of time in my garden since all this stuff went on, because that's how I deal with a lot of my stress. I used to have a t-shirt that says, that gardening is cheaper than a psychiatrist. And, for me, sometimes you get tomatoes. So I get something out of it. I am a lifelong learner and educator. The more I learn, the more I know I need to learn. And once again, my greatest thing now is I'm learning how to surf. Wish I were surfing for real, but it's a lot safer this way. So basically, we're going to talk about a number of things, and I have a few things I'm going to pull into at the end, one of which I just listened to less than an hour ago. And we're going to talk about what stress is, the different types of stress, how it affects us physically and emotionally, and then things to prevent the stress in the first place, which prevention is always our major goal, and then solutions if we already have it. So basically, it's hormones. You have too much get up and go, which is your sympathetic nervous system, and too little rest and digest, which is your parasympathetic. And I tried to find a really good definition. This is the one I like the best. Basically, it's your body's reaction to a perceived threat. It doesn't have to be real. It's just your body says, oh, this is dangerous. And so it reacts with stress. And the big things in life we need to strive for is to be, like the three bears. We don't want to be too hot, too cold. We want to be just right, because some stress is necessary in our life. It is part of our everyday life. It accounts for most of our appointments at the office, whether it's for insomnia or pain issues. It can be positive or negative. You could win the lottery, but then that's positive, but then the IRS comes knocking at your door for their part of it. And it could be something that happens right away, like an accident, or it can be something that you're dealing with day after day. And it's that chronic stress that really has a great physical and psychological toll. Now, you have to have stress in your life. The stress that makes us do well, that's an acute stress, it's positive, it drives us to excel, be creative, be inspired. That's called eustress. And that's that kind of stress that turns a lump of coal into a diamond. And it doesn't matter how many times I do these presentations, I always get a little antsy right before I do them. Then there's distress, which is acute or chronic, and it's when people tend to feel overwhelmed. There's hyperstress down there with the red head, which is acute. People will tend to overreact when they have hyperstress. And then there's the guy there on the bottom that has no stress. And that's a bad thing too, because people feel unchallenged. It's people that are in jobs that don't challenge them, or people in school. My husband and I were talking about a friend of our son that never did well at school, ever, and just got accepted into a neurology or neurosurgery residency. So he found what he loved in life, and he went from that chronic, unchallenged hypostress to a eustress situation, which is you know, a very big blessing for all of us to have that. So how does stress affect us? One of my husband's favorite pictures. When you have stress, cortisol gets secreted in your system. And short-term stress will cause things like tremors, headaches, indigestion, nausea, muscle aches and pains, heart palpitations. And the people around you tend to get cranky, because certainly it isn't you cranky, it's those rest of those people that are being cranky. So you're activating your sympathetic nervous system. And I always tell people S is for stress and S is for your sympathetic nervous system. So, you know, you have to have little rememberers there. So sympathetic speeds up stress. And what happens is you get into what's called the flight or fright reaction. And flight or fight reaction. And so blood supply to critical areas that you need, like when you have to run, when you have to fight or run or flight, the brain, the muscles, the heart, the adrenal glands, all these areas receive more of the blood supply. And the areas like you don't really need to digest when you're being chased by a bear. You don't need to protect your immune system on the short term. So that becomes reduced so that you can have increased supply to the other areas. You know, you need cortisol, adrenaline, because it makes you survive from acute stress, like when the giant duck is chasing you, or if the little grizzly bear comes and says good morning to you. And you will experience rapid breathing because you need more oxygen for running or fighting. Then once again, you get better blood supply, enhanced circulation, and your blood pressure will rise to meet the needs of your systems. Higher pulse rate delivers your oxygen more efficiently to your body. And some of your blood vessels, they will actually constrict. And that goes back to what they tell us back in the old days, like if you were going to get injured, say like the bear, you don't want to have those blood vessels in the skin surface area dilated, because you'd lose more blood if you got injured. So we need adrenaline. We need cortisol for acute stress. You know, people, when they get anxious, can hyperventilate. And the interesting thing about hyperventilating is it lowers the carbon dioxide in your body. And that low carbon dioxide can cause chest pain, dizziness, shortness of breath, muscle spasms. When I was a resident working in the ER, we saw a lot of people in for stress reactions, and they were sure they were having a heart attack. So that's when you give people a paper bag, not a plastic bag. You give them a paper bag, because what that does is as they exhale, it puts carbon dioxide in the bag, and then they can re-inhale it to get the carbon dioxide levels higher. But they're still able to pass a little oxygen through there so they can breathe. I had a person ask me once when I was doing this lecture that, Chris, Butch says we're stuck on the first slide. I had somebody ask me once about this lecture about the kids that hold their breath. And the thing is, they eventually pass out. And when they pass out, they start breathing again. So your body has ways that keeps you surviving. Now it's not moving at all, Chris. So I have a little technical issue here. Are the slides advancing now? Whoops.
At the bottom of the participants page, you can pass messages from there. Yes, no, and faster.
So are we on the sandwich picture yet?
Yeah, they should be.
Okay, so if we're on the sandwich picture, I had one of my employees tell me, ever since this pandemic thing started, I've been overeating. Of course, Chris comes with a podcast for me to listen to today on sleep and stress issues. And it was interesting, some of it was focused on this. Basically, when you have stress, you're trying to increase your serotonin and your feel-good hormones in the brain. So people aren't eating things like broccoli and asparagus when they get stressed. They're eating things like, I have never in my life seen a macaroni and cheese sandwich. To me, this has got to be something orgasmic for carb eaters. It's a pimento macaroni grilled cheese sandwich. So that's got to be ultimate comfort food. But when you're stressed and you want to go eat something that you know is less than good for you, like the patient who brings those amazing chocolate chip pecan cookies, have the 5-minute rule. Decide, do I really want this, or is it something else going to satisfy the need? Do I need a bath, a walk, a massage? Do I need to do some journaling? Do I need to drink some water because I'm dehydrated? And if you have to eat something, you know, look for your lower calorie options. Look for things that are serotonin precursors, like in nuts. Try to stay in the present moment, because lots of time, stress and fears are based on thoughts of the future and worrying about the future. So do your deep breathing, do your meditation, take a walk. My daughter mentioned she's never seen so many of our neighbors in the almost 30 years we've lived here as she has in the last few weeks. So when you're stressed, try to find yourself an option, and we're going to be going over more of those also. So acute stress, chronic stress, we're kind of getting into now. Remember, it's a hormonal imbalance, and hormones can make medical conditions worse. Metabolic changes include weight gain, diabetes, insulin resistant. It increases our cardiovascular risk of heart attacks, strokes, high blood pressure. Emotional is so huge. I have so many people I've been talking to about the emotional component of this chronic stress. Insomnia is huge. Fear, anger, depression. And many of us are not doing what we normally do for our health. We're not going to the gym. We're either sequestered, or we just don't have the energy, or it's closed. So chronic stress causes huge issues. The really bad thing, chronic stress decreases our immune system. And especially now, we're really concerned about what is our immunity looking like. Most of your immune system is in the gut. For you guys that were on the meeting last week, you learned about the gut lining and how we get our lymphoid tissue, where most of our immune system cells are made. The chronic stress decreases our beneficial bacteria, which means the gut pathogens, opportunistic bacteria, can overgrow. The gut biofilm gets unhappy, and most of your feel-good hormones are in your gut, so they go down, which we talked about some in the last lecture. I remember guts like mama. If it ain't happy, nobody's happy. And Hippocrates tells us all disease begins in the gut. Now, if we can't fix things through regular office visits and suggestions, we do have this test called the GI map, which is amazing and actually can pinpoint those things that are not right in your gut. And we'll be sending out a email on this in the next week or so. Okay, asthma. We've all seen the TV shows where the asthmatic gets stressed out and they can't breathe. And that's because when you get stressed and you're asthmatic, you cannot tolerate the bronchospasm. You can't tolerate narrowed airways as well as a normal person can. And also your lowered immune system is increasing your risk of bacterial viral infections, which can make your asthma worse. It triggers inflammatory things, histamines, leukotrienes, and increased breathing issues. I was listening to and also read a couple articles where one of the things they're talking about is with the pandemic going on is anything that messes up our breathing is going to make us more susceptible to worse effects if we do catch the virus, which, you know, it's one of those things that when I read it, it's like, well, duh, that makes sense. But when they're starting to do some of the epidemiology on this virus, they look at where there's more fatalities, and a lot of it are in areas with much higher pollution levels. And we'll be talking about toxin awareness next week, about how, at least, and then I have some more corona additional slides in there. But stress is already going to cause issues with our breathing, and the people that already have breathing issues. And then we need to work on it. So how can we help? We're going to talk more about that. With asthma specifically, they were talking about cognitive behavioral therapy, which you still experience the event, but you don't get as upset about it. It's actually quite interesting technique. Here's a picture for those of you who have come to the office. You may have seen mom and dad. Dad says mom married him because he looks like Tyrone. He looked like Tyrone Powers. And I actually looked up Tyrone Powers. Dad looked better than Tyrone Powers. But anyway, if you have stress, you may not remember things like getting married, things like helping your wife write the Dear John letter to her current boyfriend, because it just damages the hippocampus cells. And that's an area in your brain that's where you have learning and memory. So you can't learn new stuff and you don't remember the old stuff. And any people who have had chronic stress will say that. I've said, no, I don't remember last week because it was crazy. But it can actually cause neurological damage in your brain. What else stress? We mentioned insomnia. And there are some simple techniques. Remember, everything you're running away from is in your head. And most of the time you're worrying about things you can't control anyway. So when you can't sleep, try to figure out, why do you have stress? And you can try some of the simple things: counting sheep, having a glass of milk, to reduce those stressful things, taking your hot showers. We'll get into that. And then if you want to do medications or supplements, make sure you discuss it with your physician, especially if you're doing both supplements and medications, because there can be some interactions there. What else? How healthy is your relationship to stress? You see people under horrible stress that are just absolutely fine. And then you see people with minimal stress that are not fine. And stress is not what we're exposed to as much as what is our reaction to it. Life is 10% of what happens and 90% of our reactions. Do you respond to stress by over-drinking, overeating? I love this expression about anger. If you're angry, that many times people are stressed because of that. And it's holding on to it is like drinking poison and expecting the other person to die. It doesn't work that way. What else are we doing? Do we have positive experiences with stress? Playing with our grandkids. Well, now a lot of people are seeing the grandkids via FaceTime and Zoom like we're doing. Or, I had a patient telling me that his grandson was kissing grandma through the glass door. So being with your family can be very, very helpful. Of course, if you've got 3 generations in the house for the last month, maybe going out doing some gardening would help, because get away from your family for a little bit. I only spent 7.5 hours in the yard Sunday because I was tired. But whatever you can do that makes you feel better versus doing things that cover up, because alcohol and sugar and overeating ultimately make you feel worse. So how do you react to stress? You have to have a plan. So when stress hits you, you know what to do, because once it hits you, you're not thinking as clearly as you could. So you have to have a plan or you're going to fail. You're going to fail a plan. If you don't have options, you have stress. If you don't have goals of what you're going to do when situations hit you, you're going to not succeed because you won't know where you're going. If you don't know where you're going, you won't know where you get there, when you get there. And another expression I like, sci-fi background, is no matter where you go, there you are. So you can't really, when you have issues, you can't just run away from them. You have to figure out what you're going to do. So let's talk about some more tactics. Meditation, yoga, Tai Chi. I don't do so good with just sitting there and meditating. It kind of aggravates me. But if I can do yoga or Tai Chi, which to me is like an active meditation, that can be incredibly helpful. And you have DVDs, CDs, YouTube. There's lots of ways to do that. Have leisure and fun activities if you can. Have a hobby. If you don't have a hobby, you might want to start a new one. And then sleep was absolutely critical. And interesting, that webinar that my husband got me, or podcast, actually it's a TED Talk that my husband wanted me to listen to. I didn't get to listen to it the second time, but it was interesting because they were talking about sleep and vaccinations. Like when this new virus vaccine comes out, they were talking about the flu vaccine. And if people are getting inadequate sleep, the vaccine is less effective. So that's kind of interesting. So sleep, we're going to talk a little bit more about too. A few more stress management techniques. Journaling. A lot of people like to write things down, and there are people that write happy things down. They have their positive journaling. There are people that, oh, these horrible things happen. They write it down, they close the book on it, and they're done. I've had patients that write happy journals, so when life gets interesting, they can go back and say, I am so grateful for this, 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 and this. And makes them feel better. Having a belief system. A lot of churches, I saw one that was doing a drive-in theater service with the priest or the pastor on the big screen. There are Zoom presentations. There's ways to still connect. Having your family is very, very critical. And there's a little family group that are within the 10 people or less to do our modern day thing there. Visualization, having happy thoughts, that kind of goes along with your meditation also. Humor, laughter. I mean, it's hard to be depressed when we're watching Robin Williams or the Three Stooges or Abbott and Costello or Bob Hope or any of those people, whoever you like. Massage, energy work can make you feel like that little puppy. Toxin exposure, very critical. We'll talk about that next week. Chiropractic, there are still chiropractic offices open. Acupuncture, Dr. Chow is still available at the office. Magnetic technology, essential oils. Deep breathing, weight training. Can you do some of your weight training at home? Having a good office manager. There's Miss Teresa. I have to get a better picture of her, but that really helps my stress levels. Remembering that there are many things we can do to help with our stress, and that medicine is only for those who can't imagine doing anything else. So that's what I'm trying to do tonight, is help you to look at some of the possibilities so you can do things that are actually beneficial to your body versus, oh, let's take this drug and it will make me less stressed, but it does get to the root of the issue. Movement. I mean, when I get stressed, I work or do something. I'll go out in the yard and it makes me feel better, because what it does is it decreases those excitatory hormones in your body. Exercise, in every study they've done that I'm aware of, has not hurt anybody, unless they did, but is benefit in practically every application you can look at. And I was doing a little extra research, and it just said that exercise has been proven in studies as effective as antidepressants. And there's less side effects with exercise. Walking, dancing, gardening, rebounders are low stress. The glider things you can use in the gym or at home are less stress. It's putting your body in motion. It's decreasing your excitatory hormones versus just sitting and worrying, because the more you worry, the more you worry. So keep movement, which is probably one reason we see everybody walking and biking all over the neighborhood. All right, Shinrin Roku, forest bathing. This is as good as or better than exercise, and exercise is as good as antidepressants. It's an interesting, whoops, Chris, my Shinrin Roku disappeared.
Hang on a second.
Well, I wanted to say something anyway. It's really interesting that they say
You broke it.
what has happened is the world is a lot quieter than it used to be. We don't have as many people on the road. We don't have as many airplanes flying around. And, you know, with a lot of people getting outside, they're actually hearing things and seeing things that they've not heard before because they were too busy. They didn't get outside and walk. They didn't get outside and ride their bikes. They didn't hear the birds. But the Shinrin Roku it's forest bathing. It's a Japanese concept where rather than just walking in the woods, you actually try to connect with the environment. So you can, you know, look at the little ants running around. You can breathe in the aromatic from like the pine trees or the cypress trees. So you really connect with the forest versus just walking there and saying, okay, I'm here. So let me see if I can go down one. Okay, there we are. So, and it's really interesting too, as I was listening, they were talking about the geologists, the ones that listen to earthquakes are actually hearing little teeny tiny earthquakes they didn't hear before because the world's a lot quieter. So if you can find some nature to be out in that the park rangers or the police won't get you for being where you're not supposed to be, this is a very, very positive technique, which works as well as antidepressants, and it works better than exercise. Yep, I love this too. Let's talk about nutrition, because when your diet is wrong, medicine isn't going to solve the issues, and diet's correct, you have much less need of medication. And we're all old enough. We know what a healthy diet is. I always tell people Krispy Kreme donut, bad, avocado, good. So looking at eating your fresh, preferably fruits and veggies. If you're a single person or only 2 people, lots of times I'll recommend to my patients that they get frozen vegetables and fruit so that they don't go bad before you can eat it. You want to eat good fats and fiber. If you eat meat, you want to do leaner meats, and you want to do organic because there's a lot of stuff in commercially raised beef. Whole grains, if you do grains. Breakfast, Mom always said, most important meal of the day, but now we're looking some metabolic types do better without it. But in general, breakfast is really important. Everything should be organic as much as possible. And you want your foods to be nutrient dense. I have a talk specifically on nutrition, which we may do next after the toxin. We want to avoid processed foods and what I call the evil white things: white bread, white rice, white pasta, white sugar. Sugar specifically kills our microbiome. We talked a little bit about that. It raises your blood sugar and then drops you like a rock. And it can make you have more trouble with yeast overgrowth. It's really, now it tastes good, but it's bad. Caffeine, if you drink 2 pots of coffee a day and you're stressed and anxious, you probably want to cut back because they can make you more stressed and anxious. If you skip meals, you get low blood sugar, which makes the people around you cranky. So trying to keep to a regular meal schedule can be very beneficial when you're stressed. And avoid those empty calories, because lots of times when you eat food that's not nutritious, and for me, a great example was one day we went from work here to Lafayette. My daughter was going to be singing in her choir, didn't bring any food with us, so we stopped at Burger King. And I hadn't ordered food at a place like that in so long, I didn't even know what to order. So I got myself a burger, and after I finished eating it, I was hungry. And I know I'd eaten at least 500 calories, and it's kind of like that old Wendy's commercial, where's the beef? I had eaten a bunch of calories, but there was very little nutrition. And that can make you overeat too, because your body is looking for, where's the beef? Where's the nutrition in this food? There's some people that say, oh, I'm too nervous to eat. I don't feel, it's like, find a company, and we work with a number of them, that has a good shake. Have a shake. And the thing is, once you start eating, your body will sometimes be more willing to accept that. But when you're not eating and you're stressed, it's a really bad combination of things. So let's see, what else do we have here? Oops, okay, we did that one. Supplements. We check a lot of these at our office, unlike most doctors. These are some supplements with stress that tend to really drop. Magnesium, your omega-3s, which are also good for your brain health, B vitamins, and if you have the MTHFR gene, then your B vitamins may not be working for you the way they should. Vitamin C tends to get real low. Your antioxidants, I used to have good antioxidant levels before all this, and I checked it the other day, and it's like, I guess I better do some more supplements because what I'm eating wasn't cutting it. So what's nice in our office is we can actually check a number of these to see if you need to supplement it, either through your diet or through supplementation. But once again, make sure you talk to your doctor. As I mentioned, we do specific nutritional testing, and these are some of the ones we do. And people will say, well, oh, I eat a great diet. I eat all these vegetables and stuff. But it's not even what you're directly just what you're taking. It's what does your body need? And if you're under increased stress levels, it needs more antioxidants. It needs more magnesium. It needs more of a number of things. And we do blood work. We do Z2020 test, which is communication medicine technique. We do expanded thyroids. We do brain chemistry testing. And then once again, the GI map looks at your gut, which is critical for everything. Any of y'all that have been in my office know we always talk about water. Half your body weight in ounces, 2 for 1 for caffeine. More if you're out there sweating, because if you don't drink enough water, your brain will shrivel up like a little prune and you don't think well. If you don't have water, you can't detoxify. You can't breathe. When I was a kid, mama would always say, oh, you've got to drink enough water. If I don't drink enough water, I get an asthma attack. Well, she was right. If your mucus in your lungs is all dried up, you're going to have thick stuff in there and you're more likely to have an asthma attack. They've shown that adequate hydration can help with depression. It can help your blood pressure be more normal. It can help with things that hurt, anxiety, reflux. There's a great book called Your Body's Many Cries for Water by a man called Dr. Batman Jelly. And he was a political prisoner, and he worked with prisoners to keep them healthy, but he really didn't get anything to work with them except water. So he found out the guys with low back pain got better because the discs in your back are like jelly donuts. And if they dry up, they shrink. They compress the nerves. Your back hurts. But if you hydrate those discs, they're not pressing on the nerves. So many, many things are actually helped by water. And if you turn on the tap, it's essentially free. What else? False friends. When I did a Qantas lecture, a couple Qantas lectures, I always had some guy in the back that said, if I can't sleep, I'll just take a shot of whiskey. Well, with alcohol and smoking are what we call false friends, or faux amis in French. And the alcohol will, yeah, it'll put you down. And that TED Talk actually talked about it, the difference between sleep and sedation. So the alcohol will sedate you. The sleeping pills will sedate you. But when you do that, it stimulates, actually stress. It stimulates the release of cortisol by your organs in your system, pituitary, adrenal, hypothalamus, and then you start waking up more. And then also, when your body starts detoxifying the alcohol, it increases the stress response. So alcohol initially seems like it helps, but it really doesn't solve the problem. Smoking, well, people say, oh, when I smoke my cigarette, I feel so relaxed. It's like, because if you're nicotine addicted and we're giving you your drug of choice, yes, you're going to feel better. However, smoking raises stress through increasing your heart rate and blood pressure. It makes muscle tension. It decreases your oxygen. And then if you don't keep smoking, then you start to get withdrawal. So these are your false friends, your alcohol and smoking. Don't really help. I didn't even put vaping on here because when that first came out, I thought, that really doesn't sound like a good idea. And now they're having people dying from vaping. So the thing for vaping and smoking, neither of them are good for us. So why worry? So if you have a problem in your life, no, well, don't worry about it. And if it's yes, can you do something about it? If it's no, then don't worry about it. And if it's yes, do something about it, because they say people worry, over 90% of people worry about, they have no control over, they can't fix it, but they sit and worry. My mother was a great worrier. It's like, oh, it's going to be so bad for my kids and my grandkids. But I tell her, Mom, you can't control that. Don't worry about those things you can't control. So I have two things on that. One is Serenity Prayer, which I like. Accept the things you cannot change. Change the courage to change the things I can, and the wisdom to know the difference, especially these challenging times. I mean, there are things going on we have no control over. So we have to learn to ride the wave and surf. You can also be like Elsa, for those of you guys that have grandkids. She sings, let it go. Let go of the stress. You can't control it. Go for a walk. Because if you can't fix it, you can't fix it. One of the things my husband and I came to believe real early is there are really no problems in life. Whether, and this pink one is a new one I put up here, whether you're feeling challenged or blessed, every experience is an opportunity to learn and grow. There are no such things as problems, just the opportunity for solution. I love the little shark down there. Remember, we don't have problems, only challenges. So at our office, it's like we do not have problems. We have many, many divine opportunities to learn and grow. And just having the right verbiage makes a difference. We don't have problems. We just have things that are helping us learn and grow. So a little summary page here. Identify what's stressing you out. Recognize how bad stress can be for your physical, social, and emotional health. Utilize healthy methods and modalities to relax and manage your stress. And there are so many options. It's just figuring out what works best for you. That, like I said, meditation just aggravates the heck out of me. When I do yoga and they say, oh, lay down and relax and think, no, it's like, no, it's like, I have things to do. So if you're like me and meditation aggravates you, do some yoga, do some Tai Chi, go for a walk, go for bike, work in the garden. Prevent your stress and treat your stress by healthy eating. If you don't eat as well as you should, take some supplements, get some regular exercise, work on things to make your sleep better. Plan for what you're going to do when you have stressful situations. Don't worry if you can't control it. And we'll do toxin awareness next week. You know, let it go if you can't control it. Have the serenity to know the difference between what you can and what you can't control. I mean, I know there are some people I run into that just seem to love worrying about things. And those are the people I choose to not spend a lot of time with, because I don't need them getting me stressed out. I don't need to let they don't get me stressed out. I let them get me stressed out. So discuss your stress with your doctor. And if they don't have time, we do. This is part of our staff, Miss Gabby, those of you that, she's still in and out. She's expecting her second baby now. If you want to reduce your medical and health stressors, if you like what you heard, you want less stress for your family's medical care, we're a very small practice, probably a much safer place to come than a lot of other doctors' offices these days. And we try to not make drugs our first choice in helping you heal. And if you want to talk to us, we have our meet and greet. The 2 free monthly classes at the office have now turned into weekly classes on Zoom, which I'm learning. But we would welcome you, that if you're not a member, to come and speak with us. You can check us out on our Facebook page to see these lectures if you've missed any of the others, or if you have anyone else who's interested, we'd love to share. Always have to put a picture of Elvis here so we can, you know, say thank you very much. And once again, the commercial, that if you like this type, if it sounds good and an individual medical practice appeals to you, come see if what we have is what you need. And this is one my husband put in here. And it came from a fact when I was at a meeting a few years ago, somebody asked one of the speakers, could I ask you a quick question? And his reply was, well, doesn't mean I can give you a quick answer. It may be a quick question, but a quick answer doesn't always take care of things. I'll have people ask me after a meeting like this, oh, well, what can I do for blah, blah, blah? It's looking at the whole person is really, really critical in my practice. And that's what we really enjoy doing. It's kind of that Marcus Welby approach. I have to always have a panda, so I decided to put an unstressed panda in here for Miss Teresa. And my technical support will help if we have questions. And there's our contact information.
Okay.
But it doesn't have our Facebook page, but it's the one with me in the yellow shirt. So check it out. So do we have questions, technical support team?
Okay, everybody's unmuted now, so this could get fun. We have about 15 people on.
Anybody have questions? And you can put it in the chat and we can read it from the chat. Next week, we will be talking about living and thriving in a toxic world, which I've made some interesting additions to already. Chris tells me, it's like, can't you ever present the same lesson twice? And I'm like, no. So that will be same time, same Zoom contact. You can click on the same link. And I appreciate you being here. Hope there's at least a little tidbit that you can use.
Here's the,
Questions?
here's the,
Okay. Does anybody have questions? Hey, Miss Celeste, I see you. I see your name.
Hey.
And there's Mr. Butch. Hello.
exploring outside, Martin.
Oh, hey, Vanjie. When are we going to go back and exercise, man? I miss it.
I don't know. I miss it too.
I miss it, man.
Yeah.
There's Miss Allison. Okay, but if y'all don't have, if you have questions later, you know, you can always call the office leave us a voicemail, or if you're MDVIP, send it to the website, but I prefer phone calls or faxes.
I'm gonna show you how to play the ninja game, Dad.
This is good. So Brenda Spikes.
I'm gonna show you.
All right. Well, we will talk with you guys next week, same time, same station. And y'all have a blessed week. Be safe. And whatever we can do, give us a holler. And somebody has kids, aren't they lucky?
Well, have a good night.
Take care. Thank you much. Oh, too much sitting. Yes.
I'm not sure who's.
I don't know.